A very warm welcome to one and all. So today we'll be studying about salivary glands. Before we jump into the depth of salivary glands and the histology of salivary glands, let us understand what is a gland. A gland is a specialized epithelial tissue that has the ability to secrete. Glands can be an exocrine gland or an endocrine gland. Exocrine glands are the glands that produce and secrete substances through a duct. And endocrine glands are the glands that produce and secrete substances directly into the bloodstream. Coming to the endocrine glands are a part of the endocrine system. They form hormones and release it into the bloodstream. Examples include the pituitary gland, adrenal gland, pancreas, kidneys, and others. Exocrine glands produce other substances but not hormones and secrete it to the exterior of the body through the ducts. The examples include salivary gland, lacrimal gland, mammary gland, sebaceous gland, and others. Coming to the classification of glands, it is based on the number of cells that can be unicellular, that is goblet cells, the mucus secreting cells. Multicellular is the salivary glands. Next classification is based on the mode of secretion. So it can be apocrine, merocrine, and holocrine. Apocrine is the secretions are going to be released via exocytosis. So here, as we can see in this figure, the secretions are going to be released through exocytosis. Apocrine is they're going to bud off their secretions through the plasma membrane, producing membrane-bound vesicle. So here, a membrane-bound vesicle is going to be formed. And in holocrine, they are going to produce their secretions in the cytoplasm and release with the rupture of the plasma membrane. So here the plasma membrane only is going to get ruptured in order to release the secretions. Coming to salivary glands proper, salivary glands are going to be a group of compound exocrine glands that are going to secrete saliva. They're exocrine in nature, multicellular, compound, and they release the secretions through merocrine mode of secretions. Coming to the structure of salivary gland, the structure of salivary gland is comprising of the two units, that is the parenchymal component and the stromal component. The parenchymal component is the epithelial component, and this is going to be derived from the oral epithelium, and that consists of the terminal secretory units that are going to leading to the ducts that are going to open in the oral cavity. And the stromal component consists of the connective tissue component that supports the parenchyma and consists of blood vessels, nerves, and lymphatics. This is going to form a fibrous capsule, and this extends into the connective tissue septate that divides the gland, forming lobes and lobules. So, when we have to understand in brief about the cells and the extracellular matrix which is going to be present in the salivary glands. So the cells are going to be the fibroblasts, macrophages, mast cells, the fat cells, leukocytes, and the plasma cells. And the extracellular matrix is going to compose of the collagen fibers and the ground substance made up of proteoglycans and glycoproteins. It also has blood vessels, nerves, and lymphatics. So coming to the parenchymal component, the parenchymal component is nothing but the epithelial component. It is derived from the oral epithelium and consists of the terminal secretory units. So the basic functional unit of a salivary gland is a terminal secretory unit. A terminal secretory unit is basically composed of an acini or an acinus, and the cells of this acinus, irrespective of their location, position, and size, are going to be derived from the epithelial secretory cells, that is the serous cells, the mucus cells, and the myoepithelial cells. So the acinar cells, these acinar cells can be derived either from the serous cells, mucus cells, myoepithelial cells. And these cells are going to be only present in a single layer, and these cells are going to be resting on a membrane that is the basement membrane. and they have a star-shaped central lumen. This lumen intervenes into the intercellular canaliculi, and this is connected into various ducts. The central lumen is connected through various ducts in order to follow into the main excretory duct. So here also we can see that this is the acini. The cells can be a serous, mucous, or myoepithelial cells. This is the central lumen, and they are going to be connected by an intercalated duct, striated duct, which is further going to lead into forming the main excretory duct. So as I said, the types of cells can be serous cells, mucous cells, or the myoepithelial cells. So coming to the serous cells are going to be pyramidal in shape. They have a pointed apex. The apex is going to be towards the lumen, and they have a broader base, and the nucleus is spherical in nature, present at the basal third of the cell. The cytoplasm is going to be more prominent, and the apical half of the cytoplasm is going to contain the secretory granules, that is the zymogen granules, and the eosinophilic in nature. The basal half is basophilic in nature and mainly composed of rough endoplasmic reticulum. Overall, the cytoplasm has a purplish intense stain, and the secretions are going to be watery in nature, rich with proteins, enzymes, and less CHO. And the diameter of this zymogen granules is 1 micrometers. Coming to the mucous cells are also pyramidal in shape, but the nucleus is flattened to the basal third, and the cytoplasm is light basophilic. The secretions are going to be more viscous, rich in CHO, mucins, and less proteins. So coming to the electron microscopy of the serous cells, the basal half, as we can see here, is basically composed of organelles. Organelles such as the rough endoplasmic reticulum, the Golgi complex, the mitochondria we can see, the ribosomes, lysosomes, and the microfilament network. Coming to the apical half, this apical half is basically consisting of this zymogen granules. These zymogen granules are regular in shape. They're spherical in nature, and they're surrounded by a unit membrane. They're electron dense. And we can see that it has these basal foldings, intercellular canaliculi, and microvilli. Coming to the electron microscopy of the mucous cell here, in case of serous cells in the basal half had more of rough endoplasmic reticulum, but mucous cells have more of Golgi complex, less rough endoplasmic reticulum, and mitochondria. And the apical half consists of secretory droplets. These secretory droplets are mucinogen droplets. They are larger in their size, they are irregular in shape, and they are not covered by a unit membrane. They're translucent in nature. Here we don't see any presence of foldings, canaliculi. To brief about the differences between the serous cells and the mucous cells, the serous cells, the shape is going to be tubular. The serous acini is tubular. The lumen is going to be narrow and regular. And the cells here are serous cells with spherical nucleus. In case of the mucous acini, the cells, the shape is going to be tubular. They're larger and have irregular lumen. And the cells here belonged are the mucous cells with flattened nucleus. So that's what we saw about the serous cells and the mucous cells. Next, we have to understand is the concept of the serous demilions. So here, what are the serous demilions? These are the serous cells present at the distal end of the mucous tubuloalveolar secretory unit of certain salivary glands. These secrete the proteins which contain enzymes such as lysozyme, and they degrade the cells of the bacteria. The third cell, these are the serous demilions. So, to finally brief about the differences between the serous cell and the mucous cell, the serous cell have a spherical acinus, pyramidal in shape, spherical nucleus, intense stain of cytoplasm, rich in proteins and water, and has granules which are spherical, small, regular, unit membrane bound, and electron dense. Coming to the mucous cells, they have a tubular acinus, pyramidal in shape, flattened nucleus, light stained cytoplasm, viscid rich in CHO secretions, and the storage is in form of the droplets that are irregular, larger, and not bound by any unit membrane. The serous cells had prominent rough endoplasmic reticulum, but the mucous cells had prominent Golgi bodies. And serous cells showed prominent basal enfoldings, microvilli, and intercellular canaliculi. So the third type of cell which we saw in the acinar cells can be a myoepithelial cell. The myoepithelial cell is thought to be a variant of the smooth muscle cell. But indeed, the origin is epithelium in nature and has a muscle cell property. It is known as a basket cell that cradles the acinus. In H&E staining, when we stain a myoepithelial cell, only the nucleus can be seen. And the cytoplasm is filamentous. As I said, it resembles a smooth muscle cell. So it has this actin and myosin filaments, and nucleus and organelles are present in the cell body. This myoepithelial cell may be associated with a duct. Most commonly, it is associated with an intercalated duct and a striated duct. So this myoepithelial cells are spindle-shaped or star-shaped and have few processes. They support and prevent the over-distension, regulate the diameter of the intercalated duct, and aid in rupture of the acinar cells for secretion. So we understood when we started with the structure of a salivary gland, we saw that there is the main unit, the functional unit is the acinus. So we saw the type of cells that an acinus can have is serous, mucous, or a myoepithelial cells. So these were a single layer of cells and they were lying on the basement membrane. So now we understand about this basement membrane. So the primary function of a basement membrane is to anchor down the epithelium to the loose connective tissue underneath. So we understood that there were two components, the epithelial component and the connective tissue component. So the basement membrane functions to anchor these two layers of the salivary glands, and that is through the substrate adhesion molecules. Now we have to understand about the ductal system. Ductal system not only allows the passage of saliva from the cells to the lumen through various types of ducts to exit into the main excretory duct, but the functions of the ductal system includes the participation, like it participates in the production and modulation of the saliva. The ducts of salivary gland allow the passage of the salivary juice from the glands into the oral cavity. So when in general we have to study about this ducts, we have the parotid duct. So the duct of the parotid gland is the Stenson's duct, and this connects the parotid gland to the buccal mucosa, and that opens adjacent to the maxillary second molar. Next is the duct of the submandibular gland, that is the Wharton's duct, and this connects the submandibular gland to the floor of the mouth. So coming to the classification of the ducts, we have based on the location. So based on the location, it is the interlobular duct and intralobular duct. Interlobular duct is the duct that is going to be present between the two lobes, and intralobular duct is the duct present within the same lobe. Coming to the classification based on the diameter, it is the intercalated duct, striated duct, and excretory duct. So when we go from inside to outside, that is from the intercalated duct to the excretory duct, the diameter of the duct goes on increasing. Coming to the intercalated duct. Intercalated duct conveys the secretions from the acinus to the striated duct. So intercalated duct is the first portion of the ductal system. This intercalated duct comprises of cells which are going to be low-cuboidal in nature. They have a smaller diameter with a central nucleus. They have less of cytoplasm and few secretory granules. And this intercalated duct is going to secrete lysozyme and lactoferrin. These two components are going to be added to the saliva. So as I told you that these ducts not only help in the passage of the saliva, but they also help in the production and the modulation of saliva. So these two enzymes are going to be added to the saliva. Next is the striated duct. So intercalated duct and striated duct, these two are the intralobular ducts. Excretory duct is an interlobular duct. The striated duct. The striated duct is a gland duct which connects the intercalated duct to the interlobular duct. That is, the striated duct is going to connect the intercalated duct to the excretory duct, which is an interlobular duct. So coming to the striated duct, it is going to be larger in diameter. This striated duct is going to be larger in diameter compared to the intercalated duct. So the cells of the striated duct are going to be tall columnar cells, as we can see. The nucleus is round, spherical in nature, centrally placed, and they have intense eosinophilic cytoplasm. And they have prominent basal striations. We can see the striations here. So these are the prominent basal striations. We can see these histologically also here. The striated duct has one of the most important functions in modulation of the saliva. So the striated duct cells function to modify the primary saliva that is secreted by the end pieces by reabsorption and secretion of the electrolytes. So these duct cells secrete calcarein that is stored in the apical granules, and the cells are capable of endocytosing the foreign proteins induced into the ductal lumen, renders the saliva hypotonic, releases sodium and chloride ions, and secretes potassium and HCO3, and adds calcarein, IgA immunoglobulin, and secretory glycoproteins. So to understand here, striated duct is going to help in the reabsorption of the sodium and chloride ions and secretion of potassium and HCO3. So this reabsorption is going to take place against the concentration gradient. This creates more pressure, that it needs more energy, and a hypotonic kind of saliva is released. The saliva that was released from the acidness was isotonic in nature, and the saliva that is released from the striated duct is hypotonic in nature. Next is the excretory duct. The excretory duct is an interlobular duct. This is largest in the diameter. They have pseudostratified type of cells, striated columnar type of cells, and stratified squamous epithelium is also going to be present. The functions are going to be, it is going to modify the final saliva, alter the electrolyte concentration, render it to be hypotonic, and adds a mucoid component. So the important point to be noted here is the excretory duct helps in the addition of a mucoid component to the salivary glands. So that was all about the parenchymal component or the epithelial component. Now we have to study about the connective tissue component. The connective tissue component or the stromal component basically comprises of the different types of cells such as the fibroblasts, macrophages, mast cells, fat cells, plasma cells. And the fibers, the reticular fibers are also going to be present, which are collagen bound. Coming to the the ground substance is made up of proteoglycans and glycoproteins, which is going to be surrounded by a thick fibrous capsule, and this extends as the septa inward to form lobes and lobules that is going to divide the gland, and blood vessels, nerves, and lymphatics are also going to be present in this connective tissue. The important point to note here is that the plasma cells produce immunoglobulin IgA, which is going to be present in the saliva. Coming to the nerve supply. So the nerve supply, you're going to understand the nerve supply of the major salivary glands. We'll go in the classification in depth. So basically, the major salivary glands is the parotid, the submandibular, and the sublingual glands. So the nerve supply to these glands is basically both of sympathetic and parasympathetic origin. Coming to the parotid gland, the parotid gland, the parasympathetic origin, of the parotid gland is going to be through the inferior salivary nuclei, and the preganglionic fibers arise through the glossopharyngeal nerve, pass through the otic ganglion, then the postganglionic fibers here are through the auriculotemporal nerve in order to enter into the parotid gland, and the sympathetic nerve supplies to the superior cervical ganglion, which is going to intervene the gland. Coming to the submandibular and the sublingual gland, the submandibular gland and sublingual glands, parasympathetic supply is going to be through the preganglionic fibers, that is the superior salivary nucleus, through the facial nerve, and the postganglionic fibers are through the lingual nerve that are going to intervene both the submandibular and the sublingual glands, and the sympathetic is going to be through the superior cervical ganglion, which is going to enter the gland. Coming to the types of glands, as I said, that the glands can be major salivary glands and minor salivary glands. So the major salivary glands are the parotid gland, the submandibular gland, and sublingual gland. These are going to be present bilaterally and they are paired. The minor salivary glands are based on their location. They're going to be present based on their location. So coming to the major salivary glands, we have three types of major salivary glands, the parotid being the largest and sublingual being the smallest in size. Coming to the parotid gland is largest. It is going to be present in front of the ear, behind the ramus of the mandible, and has serous secretions. 60 to 65% they are watery, rich in proteins and enzymes. And the excretory duct of this parotid gland is the Stenson's duct that opens opposite to the maxillary second molar. Coming to the submandibular gland is smaller compared to the parotid gland. It is walnut shaped. And the location of this gland is present at the floor of the mouth, medial aspect of the mandible. And the secretions are mixed but predominantly serous in nature, rich in carbohydrates. And the excretory duct of the submandibular gland is the Wharton's duct, which opens below the tongue. Coming to the sublingual gland, it is present at the floor of the mouth above the mylohyoid muscle. The secretions here are also going to be mixed, but predominantly mucus in nature and more viscous. And the excretory duct of the sublingual gland is the Bartholin's duct, duct of Rivenus, and the lingual fold. Coming to parotid gland has a well-defined capsule, a connective tissue septa. The secretory units are basically serous in nature, and intercalated ducts are going to be long, branching, and numerous in number. The striated ducts are going to be well-developed, numerous, and pink necklaces. The submandibular gland has also a well-defined capsule and connective tissue septa. But the secretory units are going to be 80% serous and few mucus acini are seen. Even serous demilions are going to be seen. Coming to the intercalated duct of the submandibular gland, they are going to be moderate in number, shorter. And the striated ducts are going to be well developed, numerous, but longer than the parotid. Sublingual gland is the gland which is going to be poorly defined. And the secretory units here are going to be the mucous cells, serous acini, and even mixed acini are seen. Intercalated ducts are here short, poorly developed. Even the striated ducts are going to be poorly developed. So this is the brief classification and differentiation between the parotid gland, the submandibular gland, and the sublingual gland. Coming to the minor salivary glands, the next type of salivary glands is the minor salivary glands. They are 600 to 1000 in number. It is seen in the submucosa of the oral cavity, oropharynx, and is not seen in the gingiva and the anterior part of the hard palate. The ductal system, when compared to that of the major salivary glands, here it is very short and abbreviated. That is, it is not complex as that of the major salivary glands. And this minor salivary glands are mostly mucous or mixed in nature. Purely serous minor salivary gland is the von Ebner gland. This is very important to note that the only serous minor salivary gland is the von Ebner's gland. And these minor salivary glands contribute to 8% of the total amount of the saliva. They secrete IgA, which plays a very important role in the immune surveillance. Coming to the classification of the minor salivary glands, the minor salivary glands, based on their location, are classified into labial and buccal glands, palatine salivary glands, that is present in the soft palate, posterior part of the hard palate, incisive salivary glands, lingual salivary glands, that is anteriorly glands of Baldwin and Nunn, which is purely mucus. Anterior inferior part of the tongue also has these lingual glands. And posteriorly, we have the only serous minor salivary gland, that is the von Ebner's gland. Coming to this von Ebner's gland, the main function of this von Ebner's gland is the ducts are going to open into the sulcus and wash through the taste receptors. That is, whatever taste is perceived, it is going to be washed out with the help of the von Ebner's gland, and the next taste can be perceived again. And these are located below the circumvallate papilla, has antibacterial enzymes such as lysozyme and lactoperoxidases. So to brief about the major and the minor salivary glands, let's have a brief differentiation between the two. The major salivary glands are bigger in size, have an extensive ductal system situated outside the oral cavity, bilateral, paired, distinct fibrous capsule, purely serous, predominantly serous or mucus, rich in mucoprotein. Secretion is intermittent and contributes to large amount of saliva. Minor salivary glands are smaller in size, abbreviated ductal system present inside the oral cavity with no distinct fibrous capsule. Mucus and mixed secretions are mostly seen. The only purely serous secretion is from the von Ebner's gland, which is posteriorly present, and the secretions are going to be IgA, which are continuous, and the saliva contributed by the minor salivary glands is very less compared to that of the major salivary glands. Next, we have to understand is the development of salivary glands. When we understood about what is salivary gland, the structure of salivary gland, the types of salivary gland, the main thing to understand is the development of the salivary gland. That is how the salivary gland has developed overall. So it arises from the focal thickening of the oral epithelium that grows into the underlying ectomesenchyme in order to form a small bud. So we can see that a bud is going to be formed here. At the same time, this ectomesenchymal cells are going to condense around the bud. So there is the condensation. One second. So here there's a condensation of the ectomesenchymal cells. This is similar to that seen in the tooth development. So a bud is formed and around is the dense ectomesenchymal condensation. So this epithelial bud then clefts. So clefting is going to take place in order to form two or more buds. So here clefting has taken place and around 3-4 buds have been formed, and this process is going to continue, and the site of budding is going to be determined by the contraction of the microfilaments which are going to be present within the epithelial cells. There's deposition of type 1, type 2, type 3 collagen proteoglycans in the ectomesenchyme. Here also we can see the dense ectomesenchymal condensation, along which the clefts have been formed here in order to divide into 2 or 3 buds. Continuing with the development, so here as in tooth development, the ectomesenchyme plays important role in the salivary gland development required for both morphogenesis and cytodifferentiation. So here also morphodifferentiation and cytodifferentiation both are going to take place. The first arch ectomesenchyme is required for the salivary gland development, but ectomesenchyme is combined with the pancreatic epithelium. Pancreatic glandular epithelium differentiates. The development of the lumen, the central lumen which is going to be there, the development of this lumen is going to start on the distal aspect and then move towards the center. The ectomesenchyme surrounding is then going to form the connective tissue and the connective tissue septa. As the lumen begins to appear, this bud clefts will further divide to form the terminal ends. So here they terminate to end the bud. And here the secretory units develop, and the innermost cells will again differentiate into different type of secretory cells such as the mucus, serous, or the myoepithelial cells, the inner cells. So to brief about the development of salivary glands, we can divide this development into 6 phases. That is, the phase 1 is going to be the bud formation, followed by the formation and growth of the epithelial cord. In phase 2, phase 3 is the initiation of branching in the terminal part of the epithelial cord. 4 is going to be the branching of the epithelial cord and lobular formation. 5th is canalization, followed by cytodifferentiation. So this is about the development of salivary glands. Next important thing is the formation of saliva. So mainly, the main function of the salivary glands is formation of the saliva. So the primary secretion was done, that is the production of the primary secretion was done with the help of the acinar cells. That is the mucus acini, serous acini, or the others. So the primary secretion of this saliva, the production of this saliva was done by these cells, and the modification followed by the modification. The modification was done basically by the intercalated duct and the striated duct. So the primary secretion, there was a formation of the macromolecular component here, followed by a formation of fluid and electrolyte content, and then it led to the modification. So coming to the formation of the fluid and electrolyte content, there was increase in calcium that led to the opening of the 2 channels, and we saw that sodium, potassium, and chlorine are present at the basolateral surface, wherein only chlorine is going to be exchanged at the luminal surface. Ductal modifications was already, we have gone through in the ductal system, that is an intercalated duct, lysozyme and lactoferrin. In the striated duct, calcarein, IgA, and the saliva which was formed was a hypotonic saliva, and in excretory duct, a mucoid substance was added to the saliva. So this is all about the ductal modification that took place. Next, coming to the composition of saliva, very important. So the saliva, around 99% or more, is basically composed of water, and 1 or less than 1% is made up of organic ions, glycoproteins, and secretory proteins. The main electrolytes present are sodium, potassium, calcium, chlorine, bicarbonates, and phosphates. Other electrolytes present are magnesium, fluorines, sulfates, iodine. The secretory proteins such as calcarein, amylase, esterases, lysozymes, lactoferrin, peroxidases, ribonuclease, acid phosphatase, nystatin, cysteine, and mucin. And secretory immunoglobulins include IgG, IgM, blood clotting factors, amino acids, urea, uric acid, glucose, lipid, and other hormones. Coming to the important thing is the functions of saliva. So the functions of saliva are protection and lubrication, along with that digestion, mastication, deglutition, speech, tissue repair, mucosal integrity, dilution, cleansing, buffering capacity, remineralization, antimicrobial action, and excretion. So coming to protection of the oral cavity, that is protection and lubrication, protection of the oral cavity. So saliva extends protection to the oral cavity and its tissues in many ways. That is, the constant secretion of saliva prevents desiccation of the oral tissues. The absence of saliva may lead to degeneration or atrophy of the mucosa. The fluid-like nature of saliva provides a washing action to flush away debris and act as non-adherent to a bacteria. The mucin and glycoproteins help in the lubrication. Saliva protects the mucosa from chemical and thermal insults by reducing the concentration and lowering the buffering capacity. The saliva causes dilution of the detritus and oral acids neutralization, protects the oropharyngeal mucosa, and has high molecular weight glycoproteins responsible for oral, oropharyngeal, esophageal lubrication. Coming to digestion, saliva participates in digestion by providing a fluid environment for solubilization of food and taste substances through the action of the digestive enzymes. That is, amylase is going to help in breaking down of carbohydrates, lingual lipase is going to help in breaking down lipids, and hydrolysis of triglycerides to monoglycerides, diglycerides, and fatty acids, along with the other hydrolytic enzymes. Coming to mastication and deglutition, saliva helps in moistening the food and helps in breaking down into smaller particles in order to initiate the process of digestion. It not only moistens the food and lubricates the food, but also plays an important role in reducing the temperature of the hot foods. Taste perception. The food that is taken into the oral cavity is emulsified in saliva and dissolved. This process is a prerequisite of sense or perception of taste. This is because of the water content that is going to be present in the saliva. Speech, saliva helps to moisten the oral cavity and it helps in vocalization. In case of tissue repair, it has certain growth factors which are going to be present that promote the tissue growth, promote wound healing and differentiation. Coming to excretion, salivary glands have an excretory function, same like pancreas and gastric acid glands have. So the saliva is generally not left to metabolize, but it is reabsorbed in the GIT, and many substances from the blood reach the saliva. This saliva can be considered as a route of excretion. So, the various functions of saliva are taking place through various components present in the saliva. The protection and lubrication is done by the mucin and proline-rich proteins. Next, the digestion is done by amylase lipase, mastication and deglutition. Mastication and deglutition is done by water and mucin. Taste perception is done by water and lipocalins. Speech is done through water and mucin. Next, tissue repair. Tissue repair is done. Mucosal integrity is done to mucin and electrolytes. dilution and cleansing through water, buffer capacity and remineralization with bicarbonates, phosphates, antimicrobial action with help of lysozymes, lactoferrins, IgA, IgM, and excretion through water. So coming to the age changes, that is fatty degeneration, that is fat cells are going to fatty degeneration, that is the fat cells are going to be replaced. Next is fibrosis. Fibrosis, where the normal tissue is going to be replaced by the fibrotic connective tissue. This can lead to scarring. Next is the accumulation of lymphocytes, decrease in capacity of protein synthesis, increase in number of lipofuscin pigments. The salivary flow decreases with age and leads to more viscous saliva, and oncocytes may be present. All this can happen because of infection, inflammation, neoplastic changes, and others. Coming to the developmental defects, here it is silidinitis, that is the inflammation of the salivary glands that can be because of the bacterial, viral, and radiation therapy. Autoimmune can be the Sjogren's syndrome. Genetic can be cystic fibrosis. Cyst can be because of the mucosal formation, that is a pus accumulation is going to take place, and this is going to be because of the blockage or damage through the path, ductal path. Obstruction can be because of silolith formation. Silolith is going to be a stone which is going to be formed in the salivary gland, or the atrophy of salivary glands. Metabolic disease such as starvation, diabetes, alcoholism, and liver disease. Next important thing is the alteration of salivary gland function. So the salivary gland function can be altered because of the increased salivation and decreased salivation. Coming to decreased salivation can lead to less functioning of the salivary gland. That is seen in case of xerostomia. That leads to dry mouth, increased plaque and calculus formation, increased incidence of caries. This can also take place because of consumption of various drugs such as antihypertensives, antipsychotics, antidepressants. Diagnostic techniques and biopsy of labial minor salivary gland should be done. Next is increased salivation, that is talism. Talism, it is the hypersalivation. Thank you.